It was something that we all worked really, really hard for, and when we were finally awarded that gift that took forever to get notice of, we were pretty excited and very proud, screaming from the treetops.
Yeah. Validated all of the hard work that we put in.
I think the main question that they had was, what is the Lantern Award? You know, they don't, that's an emergency department award, so unless you work in the emergency department, you don't really know what that is. And so a lot of questions, a lot of curiosity, and then a lot of pride. It ended up being a lot of pride, so that was really great. You know, Flora's emailing us and saying, gosh, we're really, really proud of our ED, so that was really awesome.
I think it's a big magnet for, we're getting, our census is so much higher now, which benefits the hospital in so many different ways. So it just has really been positive for everybody.
The community too, I think. You know, I think that there's been a lot of questions around the community. What's this award you guys won? What does that mean? And so, you know, being able to tell them that we're the amazing ER that we know we are is pretty cool.
And it spread through the hospital, like the emails, when we sent out an announcement, I was getting emails from staff, not just administrators on the floor. So they were like, congratulations, way to go. And I think that it inspires inside our facility. I think it inspires, they ask questions like, how did you do it? Well, we did it through shared governance. We did it because our manager supports us in trying to identify best practice and allows us to form these committees and work towards these really great lofty goals. And so that's how come we did it. And so the other floors are, how did you do it? And that inspires them to get involved in their shared governance.
Well, and you know, we're part of a pretty big organization. It's not just the 7 Swedish campuses, but now, you know, there's affiliations and all that fun stuff that go on. But, you know, when they're emailing us saying, how did you do this? You know, we've been trying to do this for a long time and we've never, you know, can you give us your book? So it was really kind of interesting to have other campuses and other emergency departments in the area email us and say, how did you do this? Tell us, what are your
Right, and how cool
secrets?
is that we have a sister hospital that got it the same year, at the same time. So Ballard Swedish Medical Center, Ballard Swedish Medical Center, Edmonds, we both got it.
Which I think goes to show the tight, you know, we have a very, you know, the ED service line that is, our group comes together every month and we really, really do empower our staff to be all that. You know, with a big organization, you know, all we can do is focus on our service line to make us shine, and being that Ballard and Issaquah, I mean, all of the other campuses did so, we all did great things, but 2 of us really had to shine this year, so it was really, really.
Well, and the exciting thing is that we're a really small community hospital that has only recently joined the Swedish organization, and so it's great that we have this award and can say, we might be small, we might be new to Swedish, but we're amazing.
We are amazing. Our psychiatric task force. We had a multidisciplinary team that came together. Doctors, nurses, secretaries, technicians.
Mental health providers, pretty much any discipline that touched the psychiatric patients came together, and with our high volume of psychiatric patients, it was really important that we knew what we were doing with them and we knew how to provide that safe care with dignity, you know, because a lot of times they're coming in and not knowing exactly what's going on, and sometimes they're just sad, so we want to be able to treat a sad person like a sad person. So how do we do that?
So we had 2 tools that we developed. There's the SAD scale that it is more of a national tool, and then the 3 S's, which is specific that we developed at our campus. And the SAD scale is a way to evaluate our patients of how sad are they and how dangerous are they to themselves and to others, and what level of care do they really require within the emergency department. and the 3 S's, you can talk to the 3 S's.
So the 3 S's are search. So every behavioral patient that comes into our facility is searched. They're searched for their safety and for our safety. And then we go to the next S. So we search, and then we decide whether or not they need to be in paper scrubs. So if there's any threat to themselves or to us, we ask them to change into paper scrubs, and we secure their belongings. And we chose paper scrubs because we thought that it kept their dignity. They weren't just placed into a gown in a room. Plus, it also is a safe environment. And then we decide whether or not they need to be SAT. And SAT to us means a personal safety attendant is positioned with them to keep eyes on them, to keep them safe. And so every behavioral patient that walks through the door gets the 3 S's, and then suicidal ideation gets the SAD scale. And our staff love it because it takes out all those questions. It helps standardize it.
Takes the gray right out of it. It makes it black and white. 3S, the SAD scale, and then 3S, and it keeps everybody safe and allows us to give the patients the dignity that they need, because there's nothing like coming into an emergency department going, gosh, I'm really, really sad. I'm not quite sure what's going on. Well, no intention of doing anything else, but I'm really, really sad. Last thing you want to do is put a sitter on them and make them feel like they shouldn't have come to the ED. So we're really proud of the psychiatric task force, and I think that that's a thing that one of the things, and we've done so many great things, but I think the psych task force is something that we are really proud of because of our vast psychiatric population. Patients will request to come to our hospital from miles and miles and miles away, and sometimes cross ambulances, will cross past 7 hospitals to get to us because we give amazing psych care. And I believe that we did that before, but now we have the tools to really say that we give great care based on evidence-based practice. So.
And it's so individualized. Those tools give us the means to give individualized care to these patients that have such individualized needs. These psychiatric ailments are just so specific and so different than the needs of other patients.
Mm-hmm. And I think that it helped us to understand our resources that we were using on the psych task, on the taking care of the psychiatric population, and it helps us justify what we need in our emergency department within the facility.
Yeah.